Hi, and happy Thursday to everybody. Thank you for spending some time with me to learn a little bit about ergonomics and getting your body ready for practicing for the rest of your life. Little disclaimer, which of course we always have to do. This program has some support from Dental Ease. So got that. Don't you want to know that? A little bit of course highlights, what we're going to be talking about this evening. Peaking and perching issues, which you will know about as soon as you see them. Some body mechanics, some equipment assessment, what we need to do in and out of the office to help us get to the point of making it through a long dental career, and the importance of stretching and what we need to look at beyond this. But why me? Why would I be the person to have a program on ergonomics? Well, a couple of weeks ago, I actually sat and thought about this. I have several is not even the word. I've probably been in the dental field for 5 decades. I graduated in September 1975 as a hygienist, but I was a dental assistant first, and then I became a dentist. So I have had many years of sitting on all different sides of the chair, and it certainly has given me an education as to what my body needs and what my body doesn't need to continue practicing. And I've been practicing all this time, so I may be doing something a little right. But let's think about that. Are you kind to your body? Do you do things for your body that you should be doing? I think one thing that the pandemic taught us is we need to make sure that we have some me time and self-care time. And this is going to talk a little bit about, this program is going to lend into self-care. I'm in a Facebook group, and I saw this comic, and things like this have been out last couple days about the dental hump and what you look like before dental school and what you look like as a retired dentist. Well, I will say I am not that far away from retirement, and I do not have a dental hump, but we do have to think about what we do and why we do it and how we're going to avoid looking like that at the end of our career. And a very good friend of mine, Tim Caruso. Sorry, Tim, I actually spelled that wrong today. Tim Caruso had made a comment about peaking and perching. And how many times do you do this during the day? That is me, peaking and perching. I am guilty of this. There's sometimes patients that just don't want to listen to you, don't want to go back. And you wind up peaking and perching. And then you wonder, why is your body screaming? Because you're not sitting and doing the right things that you should be doing. The Bureau of Labor Statistics, there's a whole bunch of statistics about non-fatal work injuries. And there are 2.8 million non-fatal work injuries and illnesses because, since 2019, there's no data that I was able to gather after that. But a lot of them resulted from days off of work. Well, the last thing we want to do is injure ourselves so badly that we have to be off of work. Healthcare averages 6 days away from work, and not just dental, but medical and nurses and people that work in nursing homes and things like that. There's a lot more days off of work than any of the other trades or businesses, as you could see. When you look at these days off of work, a lot of them had to be treated in the emergency room. And if you can read the first one, it's musculoskeletal disorders is all the way up on top for reasons that you would be going to the emergency room. And I think we can be a little bit familiar with that. Looking a little bit closer at the data, musculoskeletal disorders and repetitive motion microtasks are 2 of the bigger reasons that people are injured at work or chronically injured at work as well. I don't know if you've all seen this, but the ADA did a well-being report. And of all the dentists surveyed, a great majority of us had experienced a medical condition, back problems, numbness, paresthesia, carpal tunnel, muscle weakness, chronic pain. And so it does speak to the fact that, yes, we do have some issues, and mainly a very, very vast majority of dental professionals have musculoskeletal symptom issues, carpal tunnel, neck issues, shoulder issues, lower back pain, and severe chronic pain. I know a lot of hygienists that have had double carpal tunnel syndrome surgery, double surgeries on both hands. And it's a little bit more common in hygienists than it is in dentists, but it does happen in dentists as well. So again, something to think about what's happening with our body. A very old survey that I had seen many years ago. I was not able to access anything more recent for hygienists. Again, their issues are shoulder tendonitis, carpal tunnel is really one of the bigger ones that hygienists are experiencing. So what is all this? It's basically called cumulative trauma disorder. And it's what is that? It's just trauma from repeated activity. And it's, it's like, you hit your head against the wall so many times, and eventually it's going to hurt because it doesn't give you a chance to repair itself. And certainly we don't want to hit our heads against the wall. But let's take a closer look. Signs and symptoms of this CDT are strength issues, range and motion issues, numbness or tingling, shooting or stabbing pain, and burning or swelling or inflammation in joints or in other areas. And that's what can happen if you continually do these micro traumas, irritations, and we don't give our body a chance to rest. So yes, it's an old picture, but I don't think much has changed in some areas. We have some different ergonomic risk factors. And in dental, we're constantly in awkward positions. We are using force. We do a lot of repetition motion. We're sometimes in static postures, and sometimes we're in static postures. And when we're concentrating so hard, we're holding our breath and not even breathing, which we should be doing. I'm not even talking about breathing in this program, though. And vibration. So we kind of get all these things. And dental specific ergonomic risk factors. We have mental stress. We have a patient at the other end of our hands, and even conversations. We have to deal with all sorts of issues with that. We have visual challenges. We're basically, trying to see in a dark area. We all know that. And we're very rarely in a neutral posture. And we always have different weights and grips of hand pieces. So you could be going from something that weighs a little more to something that weighs a little less. And we'll talk about just different instruments later and what the weights of all those things can do. So when we think about the world that we live in, that we all work in, we are constantly under repetitive physical and mental stress. We now have all this extra weight due to the PPE. And of course, this is a picture from, the beginning of the pandemic when some people were wearing a little heavier shields and masks and things like that. But we still have all that stuff now. So we have to consider all that. And then there's the famous peaking and perching, which, is something that we certainly need to think about and try to correct. So there is a cycle of ergonomic stress. We have all of our risk factors. We've got the, clenching the instruments. We've got the vibration. We've got the awkward postures, different weights of instruments, and those can lead to the physiological changes and then potentially pain syndrome. And again, we want to make sure that we stop all these changes before they happen so we don't get to any kind of pain syndrome. And when we do, we have to contact our medical friends to see how we can get help for that. So let's think about what we can do. Posture is one of the biggest things that we need to think about. And I know this is kind of, humorous comic, but when you think about how you're walking and you go back to that original comic that we were looking at about the dental hump, how do you walk into the office? How do you walk in the office, outside of the office? Is your head come into the operatory before you do? Are you standing erect walking in? Is your ear lobe meeting or directly above your clavicle? We really have to think about how we're walking, because the walking is keeping a really good posture will help us remember that during the day we have to regain that posture. And let's even talk about sitting down. Certainly, we don't want to be hunched over, and we want to make sure that our back is straight. It's if you're in a chair, it's almost better to sit a little bit further away from the back of the chair, so you force yourself to sit up straight, as opposed to relying on the back of the chair to help you. But then even think about our dental stools. There is a right way and a wrong way to sit. And a lot of the dental schools have like those circle round chairs, sort of similar to the chair that's on the left-hand side, and it's flat. And it doesn't lend to a really proper sitting position. We really should be looking at where all the pressure is on the legs when you're sitting in a type of chair like that. And also look at the spine on this operator. Spine is not straight. The spine is dipping down in an area where it's probably the person is probably going to have lots of neck pain at the end of the day. And the other problem here is there's a lot of pressure on your legs when you're not sitting in a position where the chair is tilted a little bit forward and your hips are higher than your knees. We'll talk about that right now. In a perfect world, there should be perfect seating. And there's always, it's called the forward leg balance tilted position. And your hips should always be higher than your knee. And the other thing that I just want to show you is, see where the feet are? The feet are flat on the floor. I am guilty of that myself, about sometimes having my feet not on the floor, but it's really important for your feet to be on the floor so you have that right angle, the 110-degree angle, correct angle in your knee, and you're not doing any damage to any of your joints there. When I was in hygiene school, besides wearing the great little nursing caps and all that other stuff, because it was in the 70s, the instructors were very, very adamant about how we sat and where we sat, and how important it was to keep our, the elbows a little higher than the oral cavity and our back upright. And again, feet flat on the floor. And I'm sure you all are looking at that chair and going, but I always put my feet on the rungs. I do too, a lot of times. We're not supposed to. So we just have to kind of remember to keep our feet flat on the floor. So if our feet are flat on the floor, our hips can be higher than our knees. And that's pretty much where you want to be. A lot of times it has to do with the dental stool that you're actually sitting in as well. But when you talk about dental stools and dental chairs and just ergonomically talking about things, there really is no one size that fits all. It's kind of like everybody's got a different shape. Everybody's got different hand sizes. Everybody's got, my hand size is probably different than, 3/4 of the people that are watching the seminar right now. And you just definitely need to try different options that fit you, and kind of like the Goldilocks thing, this chair is too hard, this chair is too soft, this chair is just right. You really need to try options to fit you. And I know that there's a lot of sites out there that you can just buy chairs from, buy dental stools from. One of the benefits of going to actual in-person dental meetings is you get to try things, and you get to sit in chairs and stools and see what things, feel like and how they feel it, how your body feels in them. And I think that if you ever have the option and if you are in the market to actually get new dental equipment, dental chairs for yourself, your assistant, it's just really, it would really benefit for you to just to go and check out all the options that are available at a dental meeting. And see what is, what fits you the best. But again, the one thing that you want to make sure of is that you have a chair stool that has an adjustable seat, because you want to make sure that your hips are again higher than your knees. If you just go into a stool, even one of those rounder stools, just make sure that there is some adjustment capability, that you can see that there is a that you can raise you can raise your legs and lower your legs and make sure that you're sitting in the correct manner. Again, one chair size does not fit all. There's a variety of different chair sizes. I personally am using a saddle chair. I've been using the saddle chair with no back for at least 10 years. And it's been very comfortable for me. It forces me to sit in the right way. And then when you look at some of the other chairs with backs, some of the chairs with backs have a movable back, so you can actually sit in an active position. And then when you're done working in an area, you could push your back a little bit, and it gives a little bit, so you can relax your back too. Again, for the dental assistant, same thing. You want to make sure that your dental assistant is comfortable, because he or she needs to be as comfortable as you in the operatory. Again, there's a variety of different options out there and different price points, and I'm not here to to even go over any of those, but just please be aware that you have options. And then again, one of the more important, one of the four main cogs in the dental office is the dental business manager. You want your dental business manager to be comfortable. You don't want your dental business manager to be sitting on the chair that you used like 10 years ago when you were in your apartment, whatever. You really want to make sure that your dental manager has a chair that's comfortable, because they're going to be sitting for a long day too. And also make sure, again, that the hips are higher than the knees. Moving on to some other aspects of the dental office, dental operatory lighting. It is so important for us to be able to have better than adequate lights in our office. And there's now lights that have different lumens, different, shades. Some are for composite curing, some are not. I have been using I think I'm using one of the original LED lights from Dentalese that I've had in my office for many, many years. And I think the one on the left is the newer incarnation of that. But there's plenty available out there for you to take a look at. This is the best operatory light ever, all these LED lights. Patients can look into the light. I've been in the chair. I've looked into the light. You're not blinded. You don't feel like, patient doesn't feel like they're in an FBI room, being asked questions, and it's not ever, it's never warm. And oh, by the way, you don't have to change the light bulbs. I don't know about you, but I remember the nightmare of having to change those little light bulbs in those other lights that we had. And every time we had to do that, my dental assistant was like going on vacation because she didn't want to deal with it. So these LED lights are great. They're great for visualization. They're great for moving. The other thing is you want to, when you're mounting these lights, you want to make sure that they're easily movable by both the assistant and the operator, if it's a hygienist or the doctor. You want to make sure that that they work easily on the track or on the side of the chair. You want to make that's important, because you don't want to be yanking and pulling anything. Loose, magnification. We absolutely need magnification. There's two different kinds, basically, of magnification out there. There's through the lens loops, There's front-mounted lens loops that can be adjusted in a bunch of different ways. And there's a newer loop, it's called a prism loop or ergo loop. And you're basically sitting with your head straight up and looking down and not tilting your head at all over to the 20 degrees that we usually tilt our head when we're using regular loops. The traditional loops, we do tilt our head. These prism loops, they're newer loops. There's something to look into. I have not tried them yet, honestly, but it's very fascinating to me. When I'm started to look into all these things, I am probably going to see how those work, because it just seems like it'd be interesting to not have to tilt your head down at all. That would certainly save your neck and your back. And the other thing that you need to know is loops are not lifetime. You should have them reassessed periodically. Our eyes change. Our magnification needs, maybe you want them a little better. But remember, these are not things that are going to be a forever purchase. So if you were lucky enough to get them in dental school, and we were not, because I was probably in the stone age of dental school, and we did not have loops at all. But at some point during your career, you may be changing your loops out. Illumination. I know we have these great lights, operatory lights, but there's nothing better than having illumination. There are a variety of illuminations out there. Some are heavier than others. Some are ultra light, some attached to, most attached to the loops themselves, the frames. Some are now attaching to your shields. And again, it's something to consider. If you don't have both, I would strongly suggest that you consider getting some. We talk about ergonomics, we talk about wrist and finger stress. And again, when I was in hygiene school, one of the things that the instructors had told us is, even though we're scaling and we're putting pressure on the side of the tooth to get the calculus off, you should still be able to take the instrument and easily pull it out of your hand. Not that you're dropping it in the patient's mouth, but you should not be grabbing the instrument with a super heavy hand. If you are grabbing the instrument with a heavy hand, or if the instrument is too big or too small for your hand, you're causing more damage than good. Especially in hygiene, we know that. We know that, you want to make sure that you have proper tactile sensitivity, proper everything. In dental too, we want to make sure we can feel what we're doing, but we don't want to be grabbing the instruments as tightly as possible. Again, the benefit of going to either a dental meeting or having your rep come over to, with a variety of instruments for you to try if you needed to change. And I guess I should stop for 1 second. I know a lot of people are in DSOs, and you may not have the opportunity or the privilege to be able to buy your own instruments or choose your own types of material, chairs and stools. But if you have a say, any kind of a say, it'd be helpful, because something that maybe may work for a petite clinician may be something that's not going to work for somebody whose hands are a lot larger than that. So it's always good to look at the weight of the instrument. And also, instruments have different, some are more solid, some are hollow, and some have different grips on them. It's always good to try. Gloves. Mary Gavoni does an excellent program on gloves. And just to briefly talk about gloves, it's so important to get gloves that fit well and fit correctly. There's gloves that have two hands, the right and the left. A lot of us, and I will speak for myself, I just have the generic box of, small gloves. But as some of you notice, when you pull out the generic box of small gloves, sometimes, it's like Goldilocks. The glove is a little too small, or the glove is a little too big. And they're not all made perfectly. But what you want to do is you want to make sure that you have a glove on that's not pulling you and not too tight that you can't do all of the functions that you need to do, as well as affect the tactile sensitivity that you need to do any kind of procedure. So again, gloves are one of those things that I think you need to try. At least now they're not $40, $50, $60 a box. I got a phone call from one of the companies that we deal with. It said, oh, we have 100 gloves for $7.99. I'm like, wow. And what, last 2 years ago, they were $47, but you know, it's all better now. Hand and wrist stress. Again, we're going to talk about some hand pieces, and I don't know how much of this you remember in dentistry, but I resemble all of this stuff. I was in hygiene school and we were using the belt-driven handpiece. It was certainly interesting, especially if you had long hair and it did get caught up in, your hair got caught up in there. It was a nightmare. But, and yes, you had to undo the belt and replace the belt on occasion. And that was a whole physics lesson in itself. For those of you who are looking at the picture all the way on the right, the one on the top is called a port polisher. And the port polisher was basically a portable polisher, and it was used instead of the rubber cup on the bottom. And you use that to clean teeth. And as you could see, the instrument on the bottom was as heavy as it looked. It was a very heavy piece of slow speed. But we go into a little bit more modern times. What do you want to look for in a handpiece? You definitely want to look for something that's stable in your hand, that if you can get illumination out of it, you know, that's great. Some of us have the little box that, you know, you can get the LED light from. Some of them do, some of us don't. Some handpieces have the illumination already built into it. You want to make sure that it's not too heavy. You want to make sure that you're not gripping it too hard. Again, everything that you want in a regular instrument, you want in your handpiece. And again, there's all sorts of different handpieces for all sorts of different people. This is one of the better concepts that has come out in the last 20 so odd years. The cordless preventive handpieces. It's great when you have a kid in a chair and they're a little nervous and they're looking at something and it looks like a portable it looks like a regular power brush, a toothbrush, so they're not as nervous. But it's great. It's you don't have that tether on the cord that you're yanking and pulling all the time. And these are pretty lightweight. Some of them have proprietary Profi cups, and some, but the majority of them don't. So this is something that if you don't have, I'd consider looking at it, because it's great. Your hygienist will love you. And then lower weight, slow speed. If you remember the picture of the handpiece that I used when I was in dental hygiene school, now they don't weigh as much. Even, with the motor at the end, they don't weigh as much. They don't, they're not as bulky, they're not as heavy, and they feel a lot better in your hands. But again, it's, see what fits better, see what feels better. If you have the privilege of setting up your own practice, you might want to try a couple different ones, but just something to consider. High-speed handpieces have also come a long way. When I was in dental school, I think we had Star way in the beginning, and Star now has this Eris 500, and it's a pretty cool handpiece. It's very lightweight. If you have a compatible reader, it has RFID technology, and it'll track the handpiece, where it is in your practice, usage, sterilization. It's really kind of fun when you think about all the technology, but it's also really lightweight. The handpieces now are getting better, and it's really, again, important for you to be able to find a handpiece that you can maneuver in your hand and that you feel that you're not gripping every single time you are using it. electric hand pieces have definitely come a long way. As a woman, I steered away from electric hand pieces for a very long time. Now I can't live without mine. It does different things than my air driven, and I really like it. And it is lightweight. I mean, there's hardly any difference between the handpiece weight of all of the hand pieces that I'm using. So again, something for you to consider when you're evaluating electric hand pieces. And when you do evaluate these electric hand pieces, they do have the weight of everything on them when you buy them. If you look in the specs of all of these hand pieces, they will have the weight. Onto hoses and tubing. You might think, why am I including this on a program on ergonomics? Because when these vacuum lines or hoses get old, they dry out. And they are less maneuverable, and you're twisting your hand in an uncomfortable way. So preventive maintenance on all of your tubing that you have, and I know we were big on this during the heat of the pandemic and hopefully before, but it's certainly something that you need to consider to keep your instead of yanking and pulling. And remember when I was saying about using the cordless Profi polisher as opposed to using something that is on a coiled tethered to your tray. Again, our lives were changed actually it's March 2019. Sorry about that. But there's all sorts of adapters that are now out there that, again, add weight and bulk and differences and twisting of your hands that you would not have thought of before, but they are very functional, getting rid of aerosol. And there's even a hands-free HV holder. I have no idea whose this is. I just saw a picture and I thought this was kind of interesting. I don't know how many practices are still using the shields in between the patient and the operating field, but there's still a lot of practices using hands-free HV holders now. Shields in my world. Actually, today I did a preventive patient and took my shield off, and there was blood spattered all over it because of using, I think, the piezo. And I said I should take a picture of this because this would be perfect for, an infection control to actually show that there is blood splattered. But after using the shield for the years that we had used them, I will never practice without a shield. It's just so protective of my face, of my assistant's face. And I just feel that this is something, but you have to remember that the shields, again, come in various weights, and where your loops are and your magnification could be a factor as well. We also have to think about all the other dental equipment that we're using. And lasers, light curing, intraoral cameras, the weight of those, some are lighter than the others. What's tethered, what's not tethered. Some of the things that have cords, again, can be a little wieldy. Some of them that don't, could be a little heavy. But again, take a look at that. And again, and anything that you're using in your office when you're pouring up alginates and you're twisting your wrist around using the mixer, you have to just think about what you're doing. And the air polisher, if you're using an air polisher, try to find an air polisher that fits in your hand really well and that you can roll in your fingers so you can adapt it to all different areas of the mouth. When you think about office design, and again, I know a lot of us don't have a choice. We either buy an existing practice and we need to work with what we have, or we are in an office that, we can't change anything. But if you do have the opportunity to have your office, think about how you want things set up. Where do you want? Do you want side delivery? Do you want over the patient delivery? Do you want things like that? And the reason that you want to do that is because there's an ergonomic zone of where you should be practicing, where you should be sitting, how you should be sitting, 9 o'clock, 11 o'clock, 1 o'clock. You need to know. I mean, I know we kind of fudge those numbers and sometimes we're at 12 o'clock because we just can't get into an area. But it's if you can think about these areas. The other thing is you really can't use what you can't reach. So when you're in your operatory, figure out how far away things are. And if you stretch your arms out and you can't reach something in that range, then it's too far away. And either A, you don't need it, or B, you need to move it. Because when you're working, besides keeping your sterility zone, when you're working, you don't want to be, getting up, hopping around, grabbing things that just aren't there. So how do we practice pain-free? What do we do for practice changes and then some lifestyle changes? I'm going to break this up into a couple different sections. And one of them is controlling upper back pain. Really, it's so important to have proper posture in the operator chair. Hygienist, assistant, doc, we have to be sitting the right way. And I know sometimes it's a fairy tale, but we really have to try. We have to try to get some proper chair technology. If we can get our legs in a leg balanced position, our hips higher, our knees lower, and we can actually even have a chair that we can stretch our back when we're sitting, between in our little breaks, that'll help us too. Definitely magnification and illumination. If you don't have it, it'll save you. It really will. It'll save your neck. It'll save your eyes. It'll save everything. And you want to orientate the dental chair and the patient correctly. Remember the wingspan and how you want people to be and where you should be sitting. You want to make sure that the patient is, again, below your elbows, within reach. Everybody can see it within in theory, and you're not stretching over the patient. And try to relax your shoulders. I mean, this is one of the hardest things to do in dental because of, I'll own this. Sometimes there's some stress going on when you're working on a patient, and what's the first thing that you're going to do? You're going to scrunch your shoulders up and start clenching your teeth. And between the mask and the shield and everything, the only person that knows what's going on is your dental assistant, because your dental assistant can read your body language better than anybody else. But you really have to try to relax your shoulders. And if that means stopping for a second and literally taking a breath and relaxing your shoulders, try to do it. I do it all the time. Controlling lower back pain. Again, you should always allow for your pelvis to be higher than your knees. You want to make sure your feet are on the floor. I know that the rungs of the chair are very comfortable. I'm sitting right now with my feet on the rungs of the chair. You can't see me, but that's where my feet are right now. And I know it's comfortable, but it's not proper. And you're not sitting the right way and you're all scrunched up in the wrong direction. So keep your feet on the floor, please. Definitely use proper lighting and magnification. They are your friend, again, for the lower back pain as well. You want to have all your instruments within reach because you don't want to be stretching, beyond where your arms reach are. Keep your feet on the floor. And again, remember the leg balance seating position. You just, again, want to have your hips higher than your knees. I know I keep repeating that. Controlling hand and wrist pain. You want to try to work with your wrist in a neutral position, and you want to make sure that you use your fulcrums and you're in the right area. You're on the right side of the patient for the areas that are towards you, and you're on a little in the 8 o'clock position when you're at the areas away from you. You want to make sure that you're in the right position in the chair and in your wrist, and don't grasp your instruments with a heavy hand. I mean, they're your friends. Even if you're mad at them for the moment because something isn't going right, just don't don't grasp them because it'll just hurt yourself. Controlling neck pain. This is a big one. Definitely magnification illumination. Does it sound like it's a theme running through here? It sure does to me. This is a hard one. I read things, and I have two patients that can't go back. And, I'm literally standing upside down. One woman has vertigo and the other woman just is special, and she won't go back. And we work with them as best as we can. And I know sometimes we just sometimes give up and say, oh, I'm just going to twist myself into whatever position. And then like 2 hours later or at night or the next morning, you're really feeling it. Well, you need your body to be healthy. And you really need to try to maneuver your patients to be able to have them in a kind of comfortable position for you. And you might say, Mrs. Smith, this will just take, a couple of minutes. If you can just give me the couple minutes, I'll let you relax, in between, and it'll be easier and I can do a better job. Because if we can't see, if we're literally sitting on somebody's chest and doing something, stretching the wrong way, not only can't we see, but we're going to be injuring ourselves and then hurting the next series of 20 patients that are coming in. And again, relax your shoulders, which truly is one of the hardest things to do. Stretching. I'm a big fan of stretching between patients. Stretching does a whole bunch of stuff. It decreases pain. It increases your flexibility. It increases blood flow. It reduces the trigger point formation. If you've ever gone for a massage and somebody is like trying to get that knot out of your upper back, that's, a trigger point formation. You want to get those reduced. And kind of the most important thing, especially in this day and age, is it gives us a moment just to be. So if you can just stretch and do something between patients, it's really great. So in-office stretching, just again, there's my little saddle stool, and just, put your arms back, stretch up, put your arms in an L, and pull your shoulders back. Again, on the right picture, you could do it standing, have your, stretch your back out. In office physical therapy, you really need to think about some neck stretches between patients, rotating your neck gently from one side to the other, not flapping it really fast, because if you flap really fast, you're going to hurt yourself, and that's going to be a problem. Putting your back against the wall. I do this a lot, not necessarily for a posture check, but when I'm talking to my patient, and they kind of are used to it. So, but I stand at the end of the op, and I have a closet there, and I put my shoulders and my back next to the wall. So at the end of the patient visit and the beginning of the patient visit, I have my shoulders in the position where they're supposed to be. My ears are aligned with my clavicle. My back is straight. I have my back against the wall, and I can remember what it feels like when I have to stop for a second, sitting at the chair, take a breath, and just get my posture back to where it's supposed to be. There's all sorts of stretches that you could do between patients. I like even the sitting, the woman down on the bottom, sitting in the torso stretch, just to get your spine kind of realigned. Again, shrugging your shoulders, it's important. This is my secret weapon. And I know I don't have many pictures of her, but this is Harriet. And I was lucky enough to find a gym and a woman who is very into body mechanics. And Harriet has put me through, because she knows what I do. She's given me some tips of things that I should be doing in my practice. And I'm going to share a couple of them with you. And again, as I had mentioned, the gentle neck stretches are one of the things that she had mentioned. The other thing that's so easy to do is the shoulder shrug, and just up and down, just straight up and down, maybe 5 or 6 times. And again, to get the blood flowing, to loosen your shoulder up a little bit. Again, especially after a super stressful patient, you want to be able to make sure that you've got your shoulders are working again. And a hug, just just to grab your shoulders and kind of give yourself a hug. Keep your back straight. It pulls everything in the right direction. One of the favorite things that Harriet has taught me is called the bandit. And it looks easy, but it isn't, because the back of your hand and your wrist need to be against the wall, and your elbow. Now, when we're done, you could try doing this. I do this in my office often. I make sure that everything is all aligned, and you could see Harriet there, and you could see me in my office doing this with and without my crazy shields. And obviously, my assistant took a picture a little quick, and my left hand is not on top of the wall. But that's what you need to do. You need just to stand there and breathe for about 10 or 15 seconds. And that, again, will get your body into an alignment that I think you'll be able to function with a little bit better during the day. ARP, believe it or not, yes, I'm that age, had a bulletin in December, and they were talking about hand exercises. And some of these are awesome, and we should really think about it, because of all the stuff that we do to our hands, we really need to move them to, get the blood flowing, hopefully push off a little arthritis. The finger spread, I do that all the time. I do the thumb stretch, the finger touching. We need our fingers working at optimal condition. And we never really exercise our hands. And this is like the perfect time and ability to exercise your hands. And you don't have to do this in the app either. You could do this in the car, driving, whatever. Out of office physical therapy. If you do work out, which I hope everybody does, proper stretching before and after exercise. I've given myself a goal, and I walk a minimum of 10,000 steps a day. I've started that 2 years ago, and I continued it. And I really, I do my stretches. And I think that if you find one little thing that you like, do it, and give yourself some exercise. Again, it's some me time, it's some quality time for yourself. Nobody can bother you if you turn your phone off. And then focus on each individual body part, like your shoulders, your neck, exercises. Find a Harriet, find a class that's helpful to you. There's a zillion classes on the internet, but you want to find something that's, kind to your body. Definitely make sure you take care of your hands, some massage and acupuncture. Yoga is great. I know that there's a couple of dental professionals out there that teach some really great yoga classes, and yoga is really good if you like that. But if you're hurting for more than a few days, it's really important to seek medical assistance. And about a year ago, my neck was killing me. I could not tilt my chin down to my chest, or even anywhere near to my chest. So I contacted my physician, and she set me up with a physical therapist. And this was not your usual physical therapy appointment. This was kind of something that was a little different. She did dry needling on me. And I don't know how many of you have had this, or if you've experienced it, but it's sort of, it's not acupuncture. It's definitely not acupuncture. They take the needle and they put it into the trigger point, like where those big bundles of stress are in your shoulder or your neck or something. This needs to be done by somebody who knows physiology really well. So this isn't something I would go to the mall and do and find somebody that you just, all of a sudden, oh my goodness, a great idea. They're doing this. Let's try it. No. It's something that you really need to. Chiropractors can do it, but really make sure that they have the training. I know that a lot of the new physical therapy students are getting lots of classes in this now because it's something new. And the needles are placed in there for either a few seconds or several minutes. They ask you questions like, do you pass out from needles? Are you afraid of needles? You literally have to pass the needle test before they will do this to you. And then, it took me probably about 8 visits. It does increase your range of motion. It takes away the knots, believe it or not. And it's great. It's something that you should consider. If somebody offers it to you, you should consider doing it because it worked, and it works for a while. And again, she said to continue on with massages and things like that, but it's something to consider. But okay, so where do we go from here? Lots of information. We want to do what's achievable. We definitely want to do what's achievable. And what is that? We want to practice as long as we want, and we want to be pain-free. And for some of us, practicing as long as we want, maybe 3 years. Some of us, it may be, the 50 years that I've been in dental. And I want to continue to do this as pain-free as I possibly can. We really have to be mindful of perching. Try not to be, and I know this patient's sitting up, but try not to do that. That's like the no picture. Definitely remember to stretch, because I think it's really important. And again, it gives us a break. And remember, proper posture is as much as you can, that earlobe right above the clavicle. Always wear the magnification, and because it'll help, and you're not like totally inside somebody's mouth, because if you're like sitting 2 inches away from their mouth, there's no way that your back could be straight and all that other good stuff, and your shoulders are never going to be untense if you're like an inch away from their oral cavity, even with the shield. Honor your range of motion, know how far you can stretch, where your instrument should be, what should be there. If it's not available in the setup, take your gloves off, go get something, come back, wash your hands, start all over again. But make sure that you do things that are in your range, that, you're not grabbing for things and pulling more things out of joint, like your shoulder. Listen to your body talk. If you hear it screaming at you, go ahead and call your physician and get something done and have it taken care of. And I guess we've come to the end, and I want to thank everybody for their kind attention, for spending some time with me on a Thursday. And thank you, Viva Dental. Thank you for attending. I really appreciate this. And thank you, Dental Leads. I have a couple questions, and please feel free. I have a couple questions that I will answer. I find that when I sit in chairs that are tilted forward to elevate my hips higher than my knees, I end up sliding over time to the very edge of the chair, even with my feet on the floor. What can I do to remedy this? It's definitely a learning curve. Just have to position your lower area on the chair and try to keep it there. And that's actually a pretty good core exercise when you think about it, to keep your core in one spot and not move it around. I find that too. I think that that's where we get in trouble, and we kind of put our feet on the rungs of the chair because we feel like we're sliding. Sometimes it's also the clothing we're wearing. It's sometimes it's our uniform is a little slipperier than others, but I think it's just tightening your core and trying to stay in the same position. I hope that answered that question. Any tips on proper patient positioning? After all the years of practicing, obviously, you want your patient below your elbows, and you want them within an area where you aren't tilting your head more than 20 degrees down. And you want to make sure that you aren't twisting yourself, your body, to accommodate them. you need to just very firmly say to people, please, can you move? I can't see. Can you open wider? Can you open wider? Please open wider. Can you open wider? So I think that it's certainly something that, over the years, you get your comfort zone in that. But basically, the basic thing about proper patient positioning is ask the patient to help you, because you tell them, I want to do the best job I can. I'm doing excellent work, and I would like you to be, to move over just a little bit more so I can continue to do excellent work. Those exercise brochures I don't know if this person is asking me about the hand exercises. I can email that to them. If they send me their email address, I can get you the exercises and get, sure, we can get those to you. No worries. Assistants, good question. Should assistants be sitting with their feet on the ground also? No, the assistants should be sitting with their feet on the rung, because it's there, because if the assistants are sitting with their feet on the ground and they are supposedly 6 or 8 inches higher than the dock, there's no way that their legs would fit on the ground. They would be sliding off the chairs. So the assistants should be sitting with their feet on the rungs of the chair. Excuse me. As far as there was a question about an elbow injured doing retraction, I would definitely seek help for that. I know that I've personally worn elbow braces, like for a tennis elbow, underneath my uniform when I had elbow issues, but I always did those braces or a carpal tunnel brace to calm things down for a while after I sought medical help. So I would always seek medical help. I would never give you an answer because I would tell you to go seek medical help. I have a comment. I've suffered for over 10 years with hip pain from straddling the stool. Last year and a half, I've used a saddle stool and it's been a game changer. I can't say I love it, but my hip pain is pretty much gone. I agree. I think that, it's a definite learning curve to sit on the saddle chair. And your hip pain was probably caused by, being in that static position and not being able to have your hips higher than your knees. So I'm glad that you're feeling better. Okay, and I have somebody that I have to send some exercise information to, and I'm hoping that they will give me these email questions and answers when we're done. And if there are no further questions, I'm going to thank you all for paying attention. Sorry, I had the pandemic starting last year. It was really supposed to be starting the year before, but thank you all for your kind attention. And I really appreciate you spending some time with me, and stay safe and be well.